right, 20 minutes after 10 o'clock. Thank you for tuning in. Our next guest is Dr. David Lederer. He is a pulmonologist and an associate professor of medicine and epidemiology at Columbia University Medical Center in New York City. I went to the website that was provided to me, aboutpf.org, PF standing for pulmonary fibrosis. And I looked at the symptoms, and I have one of three, Robin. So I'm a little bit concerned. Oops, where are you? One of them is forgetting to turn up the volume on my partner's microphone. No, I'm teasing. No, one of them is fatigue. Look, I'm looking at the thing here.
Yeah, there you go.
But I don't have shortness of breath, and I don't have a dry hacking cough. But so 1 out of 3, right? I'm pretty good then. Just fatigue. Maybe that's just I get up early and I stay up late. Maybe that's what it is, right?
Gosh.
Dr. David Lederer is going to talk to us about pulmonary fibrosis. I don't mean to make light of it, but kind of in my contract to be light. Good morning, doctor. Thank you for being on the show with us.
Yeah, good morning. Thanks for having me.
Yeah, I'm a little fatigued, but that's not enough, right? You need to know more than that?
Yeah, fatigue is part of it, but fatigue alone is probably not enough to trigger a workup for pulmonary fibrosis. But you have fatigue along with breathlessness or along with a dry hacking cough that won't go away. That is a reason to go to our website, aboutpf.org, download the risk factor checklist, see if you're at risk, and then bring it to your doctor and find out more.
Oh, the risk. Where's the? Okay, there it is. Okay, I'm going to do that. I don't have any reason, but I'm kind of like whenever I talk to a guest, I'm always curious to see if anything applies to me. So tell me, what is pulmonary fibrosis? Can we start with the basics?
Of course. Pulmonary fibrosis is a chronic, progressive lung disease in which scar tissue builds up in the walls of the tiny little air sacs in the lungs. And as that scar tissue builds up, usually over the course of a few years, people develop those symptoms we've been talking about: breathlessness, usually breathlessness with hills, breathlessness going up the stairs, dry hacking cough, and fatigue. And over time, that scar tissue builds up enough, the lung can become destroyed. And for many people with this disease, ultimately, it is a fatal disease.
Oh my gosh! And is the building up of the fibrosis part of what we're talking about? Is that scar tissue?
That's right. Fibrosis is a medical term that means scar tissue.
Okay, and so obviously, if your lungs are scarred over, they're not going to be able to do what they're supposed to do.
That's right. So not only do these symptoms begin, but oxygen levels in the body can go down, right? That's one of the major jobs of the lung, is to get oxygen in. And so as the disease progresses, people often begin to require to use oxygen, that little cannula on the nose, particularly when they're exerting themselves or sleeping.
Are people who used to be smokers but have now quit for a few years, are they more at risk of getting this?
Well, smoking is a risk factor. Even if you've quit, this disease can develop from smoking. But smoking's only one piece of the puzzle. It seems like there are other things, too, that can trigger the disease. As people age, their risk increases. People who have a family history of the condition are also at increased risk. And certain exposures in the home or the workplace, even things like mold in the home or asbestos, can contribute to the risk of this disease. Yeah.
And you have a tool that we can use to see the risk factors.
That's right. If you go to About PF, that PF is for pulmonary fibrosis, aboutpf.org, you can download our risk factor checklist, see if you're at risk, print it out, bring it to your doctor, and then your doctor might initiate a workup for pulmonary fibrosis, including a CAT scan and other testing.
Is there any chance that younger people would be able to experience this?
Yeah, unfortunately, it can affect people of all ages, even children, although it's very rare in children. As we age, the risk goes up, but yeah, anyone's at risk. And if you're having these symptoms, even in your 20s, 30s, or 40s, it's time to go and get checked out.
Is there a way to reverse the scarring? Is there a way to undo the damage?
I wish there were. There is no way to remove that scar tissue, but the good news is that there are 2 medications that are available that can slow down this progression. So again, they don't remove the scar tissue, nor do they stabilize it into a chronically stable disease for the rest of your life. The disease still progresses even with the treatment, and that's why we're trying to find new treatments and a cure. The Pulmonary Fibrosis Foundation is driving that pathway towards a cure, establishing 60 centers around the country. These care centers are dedicated towards accurate diagnosis, accurate treatment at these medical centers. There's one at the University of Florida in Gainesville, for example. You can find a list of these centers on the website aboutpf.org, where doctors and scientists are doing research, again, looking for that cure for pulmonary fibrosis.
Are everyday household items going to be affecting this, where more people get more, like if you use hairspray, some kind of spray on deodorant, things like that?
There are about half of the people with this disease where we can't figure out the cause. We try really hard, we ask a lot of questions, we search, and half the time we're left with no idea why it happened. And we're always scratching our head about exactly what you're saying. Could it have been some dust or fume or spray or something that could have triggered it? And in my practice with my patients, my response is, I can't say yes and I can't say no. And then my advice is very simple. Only breathe air, which means if you can see it in the air or you smell it in the air, you shouldn't be breathing it.
Can I ask something? The lungs obviously are the way we get oxygen into our bodies, and when they get congested, the lungs have this way of expelling phlegm. Does the fibrosis also make it more difficult for the lungs to do that part of their job?
Well, I'm glad you brought that up, because this is a way for people to think about whether or not they might have pulmonary fibrosis. In this disease, the cough that people experience has no phlegm or very minimal amounts of phlegm. This is different than, say, COPD, where people might be coughing up thick mucus and phlegm every single day. So if you're coughing a lot, it's really bothersome, and there's really not a lot of phlegm or mucus, that's a sign that you should go to the aboutpf.org website, look at that risk factor checklist, and again, bring it to your doctor.
Can a person slow this down if you walk every day? Just take a walk?
Oh, prevent it maybe.
Yeah.
Right?
Yeah, right. So exercise is great. It helps even if you have advanced disease. Exercise is one of the best things we can do to try to keep your body as healthy as possible and improve your quality of life and ability to live your life day to day.
Oh, really?
Unfortunately, we don't have any evidence that exercise will directly affect the scar tissue, but I still recommend it to my own patients.
But you know what I was thinking when Robin asked that? I was wondering if maybe, you know how they say that if you've lost part of your ability, your brain, you've had a stroke or something, or maybe I don't know if another organ makes sense, but the part that's left over can do double duty if we work it out. That's what I was thinking might happen. Could that, or maybe the people who wear oxygen, is that a way of helping out somebody with this problem?
Well, oxygen definitely helps. I think you're thinking of liver and kidney, because if you take out half the liver, you're okay. If you take out one kidney, you're okay. And the truth is, if you take out one lung, you're also okay if the other lung is really healthy. So the other piece of good news is that some people with this disease can get a lung transplant. And so you can replace one scarred lung with a healthy lung.
Really?
And then you can live a life with a healthy lung and a scarred lung and be okay. And it's hard to be a transplant patient with medications and complications, but it is a treatment that's available.
I want to thank you for being on the air, and I want to recommend the listeners go to your website, aboutpf.org. I went there, and I found the PDF that you can download to kind of go through the checklist to see if any of the symptoms and risk factors apply to you. Thank you, Dr. David Lederer. Thank you for being on the show with us today.
Thanks for having me.
You're welcome. We'll be right back.
Fox News, I'm Chris Foster. The black boxes from the Ethiopian Airlines jet